If you're looking to learn about Medigap plans this enrollment period, as well as how to get the cost from each different company the easiest way without getting bombarded by agents, then stick around. I'm going to cover everything as well as the top Medigap plans for 2022. My name is Russell Noga with Medisups.com, and along with Diana and Teresa, these ladies are two of the top agents of the country. You can speak to one of us when this video is done and get all your questions answered. Our phone number is down below. As well, you can always get online quotes at my website, Medisups.com. I'm one of the only people online who actually shows you the rates. So that being said, let's start with what are Medigap plans to begin with. Well, Medicare has various parts to it, as you may know, called Original Medicare. Part A for hospitalization coverage, and Part B covers your doctor's services. Well, these two have what are called gaps in them. What are gaps? Well, they're expenses that you are required to pay, or your Medigap plan can help pay most of them for you. Now, Medigap plans are lettered A through N, and private insurance companies put these out. They are standardized by the government. What this means is that each plan letter must have the same coverage no matter which company offers it. So if it's a Plan G from a particular company, has to be the same coverage if another company offers it. Their rates, however, are entirely different. So while they have the same coverage, they all charge different premiums for it. We shop them all for you at no cost, ever a cost to you for our services. But you've got to watch these every year because while they have the best coverage you could possibly get, they do have rate increases every year, which is simple. You just need somebody looking out to make sure you're not overpaying on your coverage. And we do that for you. Now, while they're lettered, the most popular plans, there really are just a couple of them that most people enroll in. And coming up in 2022, that will continue. Although a lot of people will be making changes from maybe some of the higher tier plans down to the lower ones because we're finding now the coverage is incredible, and you might just have some small out-of-pocket expenses, but you can save big on your monthly premium as well as save big on future rate increases. So without further ado, let's go ahead and talk about what are the top Medigap plans for 2022. Now, the government doesn't like us using the words top or best, but let's face it, most people enroll in one of these plans. So let's just call them the most popular so I can stay out of trouble. Now, what are those plans? Well, they are Medicare Plan G, Medicare Plan N, as well as a high deductible version of Plan G. There's also Medicare Plan F, and only those who were enrolled in Medicare Part A prior to January 1st of 2020 can have a Plan F. If you are new to Medicare or just coming on to Part B, maybe you're retiring, congratulations, and just coming out of Medicare for the first time or just turning 65, you do not qualify for a Plan F if your Medicare Part A start date was after January 1st of 2020. That's okay though, you're not missing much. And you folks on Plan F, we switched probably over 600 people this year from Plan F down to either a Plan G or a Plan N. They saved a ton of money and they're in a spot where they're not susceptible to higher rate increases. So this is a good move. This video is for you especially. So let's start with what is now the most popular plan. That is Medicare Plan G. Now remember, Medigap, that whole term comes from the fact that these pay most of the gaps or expenses in Part A and Part B. Well, with Medicare Plan G, there's only one gap, and that is the Part B deductible, which you must pay annually prior to Medicare Part B paying 80% of your medical bills. 2021, this deductible is $203. In 2022, we're probably looking at about $210 around there. What happens is you pay the first couple $100 of your medical bills in the form of that deductible. After that, Medicare Part B will come in and pay 80% of your bills. If you've got a Plan G will then come in and pay 100% of your bills for the rest of the calendar year. We're talking about fantastic coverage. Some of you folks are coming off either group health insurance or Obamacare. We talked to a lot of people today, in fact, who are switching off, and they are thrilled because they're getting a big pay raise. They don't have to pay those high premiums anymore. Particularly with a Plan G, you've just got that one out-of-pocket cost, that small Part B deductible, and after that, you get 100% coverage for the rest of the calendar year. That's why Plan G is still going to remain the most popular plan for people in 2022 to enroll in. A lot of people stop at this point of the video and they say, Russell, just sign me up. Plan G is awesome. That's what I want to do. Well, you can easily go to my website, get rates for Plan G in your area, and even start the application process. We've made it so simple to get you enrolled in these plans. It's very easy. Or if you like, just give us a call at the number below and we can start that. However, I'm not done. We're going to talk about two other Medigap plans that are also very popular, but one that is rising in popularity each and every year, and 2022 will be no different. That is Medicare Plan N, one of my favorite Plan Ns. I got my old mom on Plan N. She absolutely loves it. The reason is it's got lower premiums and lower rate increases than Plan G. Now, do you get the same coverage? Not quite, but it's still very, very good. On Plan N, you still pay that annual Part B deductible. Remember, that's prior to Medicare paying. That's not a plan deductible. That is a Medicare deductible that you're required to pay. So once that few $100s is met in the form of the Part B deductible, Medicare will come and pay 80% just like it does with Plan G if you have a Plan N. However, after that, if you have a Plan N and you visit the doctor again, you might have a small copay of up to $20. Now, what does up to mean? Well, simply put, never more than $20 per visit per copay. It actually could be less or it could be no copay. It just depends on how they code your visit and what you actually go for. But if you think $20 copay after you meet your deductible, not too bad. Per visit, that's okay for a lower premium. Plan N sometimes is up to $30 a month less per month than Plan G. Now I might have your attention because I just said the copay was $20. So if you think about it, if you don't visit the doctor that often, or perhaps this year or last year, you maybe only went a couple times, boy, you could really save some good money on Plan N. There is another thing that could come up, and by the way, that copay does not apply to telehealth visits. You will not pay that, which is great. Now, there is another copay that could come up is if you visit the emergency room and you're not admitted and you've got a Plan N. Well, it's a $50 copay if you're not admitted. Why? They don't want people coming in for non-emergency items, so they try and keep them at bay and say, listen, if you come in, it's going to be $50 if you're not admitted to the hospital. One other thing on Plan N, which is not covered but extremely rare, is what's called Part B excess charges. Part B excess charges are charged by maybe 1% of all doctors in the country. So rare, as I mentioned. Now, what happens is those doctors are not accepting the assigned rates from Medicare. They'll still take you as a patient, but Medicare might pay $100. They're allowed to charge 15% extra. And that would be obviously $15 you would have to pay on a Plan N. Again, these are extremely rare, and they've found that the average excess charge is always less than $20, and only 1% of all claims even have one. Now, in the states listed beside me here, they're not even allowed to charge these excess charges. So if you're in one of these states especially, boy, Plan N is something we really want to look out for you. Overall, we're switching a lot of people down to Plan N, again, for those lower premiums. Still no network. Visit any doctor, specialist, or hospital anywhere in the country that takes Medicare. Unlike an Advantage plan, you get to choose your doctor and go to the best of the best. Well, with a Plan N, with those lower premiums and lower rate increases, it's a great option, and we should definitely see your own situation and check the rates in your zip code, which we can do now by just giving us a call below. So now we're on to what is the last of the most popular Medigap plans for 2022, and that is Medicare High Deductible Plan G. Yes, there are two Plan Gs, the first one being that standard Plan G that I talked about, where you pay one small deductible, the Medicare Annual Part B deductible. After that, you get 100% coverage from Medicare as well as that standard Plan G. On a high deductible Plan G, you still pay that small deductible, and then Medicare will come in and pay 80% of the medical bills. You're required to pay the additional amount as well as all other expenses, however, up to a certain limit. That is the high deductible. Now in 2021, that limit is $2,370. In 2022, it's probably going to be close to about $2,400. Once you meet that amount on a high deductible Plan G, Medicare and the high deductible Plan G will pay all your bills 100% just like standard Plan G. So let me give the breakdown and the order of operations here just to explain it a little better. You visit your doctor and you're required to pay that annual Part B deductible. That's one time throughout the year. Then Medicare comes in and pays 80% of your medical bills. You're required on a high deductible Plan G to continue paying the remainder of those bills up to what will be about $2,400 in 2022. After that, you'll get 100% coverage from Medicare as well as the high deductible Plan G. You could be saying at this point, Russell, you just explained regular Plan G. It was awesome. Medicare Plan N sounded great. Now you want me to pay all these bills on high deductible Plan G? Believe me, this plan is not nearly as popular as Plan G and Plan N because most people don't want to fiddle with all those various bills coming in. However, there are those, and I've got plenty of clients like this, who just never visit the doctor, but they know I've got to have something in place for the what if. In this case, high deductible Plan G could be best for you because the premiums are very low. They are less than half of a standard Plan G in most cases and in most areas. You can see the coverage isn't as good as a standard Plan G though. So if you don't go to the doctor a lot, you're very healthy, you want to stay with original Medicare, remember that benefit you earned your whole working life. You don't want to opt out like in a Medicare Advantage plan. You want to stay with original Medicare, still have great coverage, be able to go to any doctor or specialist in the hospital. God forbid something happens major, then a high deductible Plan G is great because you have those lower premiums each month and you still have great coverage. Just know you could get all of those medical bills if you start using it up to that limit, and that's when you'll get 100% coverage. Either way, regardless of which plan you think meets your needs the best, we can help you and answer all your questions and make sure you do get with the right company as well as the lowest premium. Remember, there's no cost for our services. We do all the shopping for you, can answer all your questions about Part D drug plans as well, and get you in the plan that's going to save you the most money. But we also watch it every year because they do have rate increases, and we watch those for you to make sure you're paying the least amount possible. Remember, you can get online quotes at Medisubs.com. I am one of the few people that even shows you the rates. No obligation, but easiest way is just to call us now at 888-891-0229. You could talk to myself or one of the lovely ladies, Diana or Teresa. We're here to help you answer all your questions and make sure you get in the best spot. Thanks so much for watching. We look forward to talking with you soon.